As if the economic and psychological burden of the COVID infection was not enough, there is a new fungal infection going on these days in COVID recovered patients. And this infection is known as black fungal infection or mucormycosis. It is a disease that is caused by fungus. Now let us see what is this fungus. This fungus belongs to the phylum Glomeromycetoma, which is subdivided into two orders, that is Mucorales and Entomophorales. Now these Mucorales are the ones that are important for us, and these are the ones that are causing the infections. Now, where do you find these fungi? It is said that these fungi are ubiquitous, which means that they can grow pretty much everywhere where there is a carbohydrate source for them to grow. Now they grow in decaying matter including bread, fruits, vegetables, compost piles and animal excreta. As I told, they are found pretty much everywhere. But the problem is that these fungi produce spores, and these spores can enter human body through the respiratory tract just like COVID does. What happens once these spores are inside the human body? Well, thankfully we have a immune system which fights against it, which is led by the neutrophils, which kills the spores and protects us. But if you are immunocompromised, that is, your immunity is weak, like if you are an uncontrolled diabetic patient, if you are on a long term high dose steroids, if you have had a long term ICU admissions, and if you have had diseases that reduces the immunity, you might find yourself on the negative side. Now, because it is found everywhere, how do you protect yourself? How do you prevent from getting infected? Now, these are the ICMR guidelines that are given, and it says to use the mask if you are visiting dusty construction sites. Wear shoes, long trousers, long sleeve shirts and gloves while handling soil, like when you are gardening, when you are handling mass or manure. Maintain personal hygiene including scrub bath. So these are the guidelines that is given by the ICMR when to suspect this infection. Number one requirement is that you have some comorbidity, as I have already mentioned. Then only the infection can happen. Otherwise, a normal human being is very much potent of preventing this infection. Now, how do this disease present? If you have a sinusitis, we already know what a sinusitis means. Either you have a nasal blockade or congestion, or there is a nasal discharge which is especially blackish or bloody, and if you have a pain on your cheekbone. Number 2, if you have a one-sided facial pain, numbness or swelling. Number 3, blackish discoloration over bridge of the nose or palate. Number 4, toothache, loosening of teeth or jaw involvement. Number 5, a blurred vision or a double vision with pain, fever, skin lesion, thrombosis and necrosis, and it will form eschar. What is an eschar? This is an eschar. Or if you have a chest pain, hemoptysis, that is passage of blood in the cuff or the sputum, worsening of respiratory symptoms. Imagine you have recovered from the COVID, your saturations is fine and there are no respiratory symptoms, but suddenly you have a worsening of symptoms, especially associated with the symptoms of sinusitis, cough, hemoptysis. You should consult your doctor immediately. What are the do's that is given as per ICMR guidelines? Control hyperglycemia, control your sugar levels. Make sure that you consult your doctor and keep your sugar levels under control. Monitor blood glucose levels post COVID discharge and also in diabetics. If you are admitted for COVID and then while getting discharged, you should get your sugars checked. Use steroid judiciously. Now, this is something that is very important, and usage of steroids should be monitored by a doctor. Don't get it from a pharmacist. Don't take it on your own. Don't adjust the doses on your own. You should always consult a doctor. Use clean, sterile water for humidifiers during oxygen therapy. Now, many of you might be using oxygen in the home, and you have to use a clean, sterile water for humidifiers during oxygen therapy. Use antifungals and antibiotics judiciously. Now, again, uh, you should use antibiotics only on prescription and not on the pharmacist's advice or on your own. So now, how deadly is the disease and should you be scared? The answer is yes, you should be very much scared of the disease because it is quite a disease with high rate of mortality, and the mortality depends upon the form of the disease. That is, if a rhinocerebral disease which is severe, that has spread to your orbit, to your brain, the mortality is as high as 30%, which is very high. That is, about one third of the patients who get the severe disease shall die even with the treatment. Now, pulmonary form of the disease has a very high mortality of 50 to 70%, that is more than half of the patients will die even with the treatment. Disseminated disease, that is if the disease has spread everywhere including your brain, skin, stomach, etc., the mortality is more than 90%, and it is very difficult to diagnose and treat the patients if the presentation is late. So make sure that you have knowledge about this disease, spread the knowledge about this disease, and consult your doctor as early as possible for the disease to be less fatal. If you like this content, kindly like, share, subscribe, and your subscription would encourage me to come up with more videos like this. Thank you and bye.